Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about the health-promoting properties of products of the grape. Grape seed extract, grape skin extract, and so on. This stuff is amazing. It helps the diabetic. It helps lower blood pressure. It improves the immune response. We can go on, and we will. You need to know about this. That's our concept for today. First, let's go to our news. Let's see what's happening in the health world. A surprisingly large number of North Americans have hypertension. Researchers from St. Boniface Hospital in Canada evaluated over 1,100 volunteers recruited from shopping malls, workplaces, hospitals, and community centers. They found 1/2 of all participants had hypertension, and most of these were unaware or unwilling to acknowledge the severity of their condition. Medical experts report hypertension is the leading threat to America's health. Study was published by the American Journal of Hypertension. Well, this eye-opening news, isn't it? It certainly is. This study from Canada finds that as many as half of all Canadians have hypertension, and even worse, the majority of those studied did not know they had it, nor would they accept the severity of their situation when told of the health risk hypertension carries. Now, of course, this study was conducted in Canada, and although our disease patterns are similar, they are not exactly the same, but it is possible that hypertension is far more common here than once thought. Previous estimates suggest about 20% of the U.S. population has hypertension, and about 1/2 of these do not know it or they refuse treatment. Hypertension is a major risk factor for both heart attack and stroke. It is the second leading reason why people develop kidney failure, leading to renal dialysis, and cause of blindness. Traditionally, the diagnosis of hypertension has been made when either blood pressure number is elevated, so that'd be 140 systolic points over 90 diastolic points, either number higher than 140 over 90. In recent years, hypertension experts have recommended that we begin addressing blood pressure issues when either number exceeds 120 systolic over 80 diastolic. Now, if you have a blood pressure of 145 over 95, for example, it does not necessarily mean you need a blood pressure medicine, but you should take steps immediately to reduce your blood pressure. Losing weight, starting an exercise program, reducing salt intake, reducing stress, improving your diet, and starting a dietary supplement program are all appropriate non-medication measures that help most reduce their blood pressure. Now, one word of advice: do whatever it takes to get your blood pressure under control, even if it means taking a medication. Once blood pressure has caused damage, it is mostly irreversible. Smokers over 70 are 3 times more likely to die over the next year. Researchers from the American Cancer Institute followed 160,000 subjects ages 70 and up involved in the AARP Diet and Health Study. They found older smokers are much more susceptible to disease and death. However, quitting at any age reduced the risk of death even after age 70. The study was published by the American Journal of Preventive Medicine, and also from the same journal, researchers from Ohio State University find reported smoking quit rates more than double when nurses or other allied health personnel discuss tobacco use and cessation techniques with hospital patients prior to discharge. And from the Roswell Park Cancer Institute and the Center for Disease Control, researchers find 15.1% of all Americans smoke cigarettes, 8% smoke cigars, pipes, or use smokeless tobacco, and 4% use e-cigarettes or practice vaping, as it is often called, and another 3% use some other form of nicotine replacement therapy, such as patches or gum. Overall, about 30% of all Americans use tobacco products or some form of nicotine delivery system. Well, folks, this series of studies simply confirms what we already know: smoking is bad for you. And another recent study found smokers under 50 are 8 times at risk of heart attack. 8 times. Smoking is very dangerous to our health, and quitting is always in your best interest, no matter how old you are. Cigarette smoking peaked in the 1950s when almost half of all Americans smoked. Today, that figure has dropped to record lows, just 15%, but 9% of young people smoke, possibly sentencing them to decades of compromised health and early death. One of the most popular smoking alternatives and new method of smoking cessation is electronic cigarettes or vaping. And we have been anxiously awaiting research on the safety of e-cigarettes, and we now have many or several studies to report to you. So I will quickly summarize several new studies on vaping. Overall, vaping is much safer than smoking overall, with e-cigarettes showing dramatically less toxicity than tobacco smoke. However, fruity flavored e-cigarettes, that would be your nicotine solutions that feature a strawberry or banana type flavor, and high amperage e-cigarettes that produce large amounts of aerosol, well, they are very toxic, and should be avoided. Next, teen use of e-cigarettes has increased dramatically, and if their access to vaping is restricted, their smoking rates increase, as does smoking among pregnant teens who can't get to vaping. Many are concerned that vaping leads to smoking, and yes, teens that first vape are 4 times more likely to eventually smoke cigarettes, real cigarettes. Kids that live with e-cigarette users are more likely to think smoking is okay. And finally, those who use e-cigarettes feel their use is as satisfying as, or more so, than smoking cigarettes, making it helpful in quitting. Now, bottom line, using plain vaping solution with low to modest aerosol output is far safer than smoking and a good way to help people stop smoking over the short term. I cannot recommend that non-smokers vape, and those that are vaping should make every effort to decrease and eventually stop the use of all nicotine products. Why be dependent on anything, right? Well, today on Your Health, we will discuss the remarkable health-promoting properties of the grape. So stay tuned for grapeseed extract and resveratrol.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online or call 888-442-1828 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings.
Dr. Becker, and this is Your Health at a Glance. Are you one of the millions of Americans who are at risk for heart problems? If your diet is like the average American's, you're getting far more sodium than your body needs, and this may create serious problems for your heart. A new study from the Netherlands showed that a diet high in salt not only increases blood pressure to dangerous levels, it also causes damage to your blood vessels. To avoid these problems, you need to avoid foods that are high in salt, such as preserved and prepared foods like frozen dinners, canned soups and other canned foods, cured meats such as lunch meat, hot dogs, bacon and sausage, condiments and sauces such as soy sauce, teriyaki sauce, and spaghetti sauce, and snack foods such as salted nuts, pretzels, and chips. Eat fresh fruits and vegetables, fresh meats, poultry, fish, and other salt-free alternatives. As you decrease your intake of salt, your desire for salty foods will eventually be reduced. For Your Health at a Glance, I'm Dr. Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with GastroDefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-1828 and ask about the AutoShip program for additional savings. Welcome back, everyone. We hope everything is wonderful in your corner of the world, and I want you to know how much we appreciate you being with us every day. It's such a privilege to be able to bring you all this information about good health, and today is no exception. This one is fantastic. We're talking about the health benefits of the grape. Richard, the grape is just, it's amazing.
It is.
Absolutely amazing.
It truly is.
We have the grape seed, we have the grape skin, we've got all the different portions of the grape that have different properties, but combined together, what a difference they make in our health.
Yes, and scientists have noticed that very phenomena, and there is a huge bank of knowledge now on the health benefits of products of the grape. Grapes have been used throughout civilization, both as a food and as a medicine for many hundreds of years. In fact, there are over 250 references in the Bible to either the grape, to wine, or the vine, all products of the grapevine. And in the Bible, it's typically used to symbolize life itself. Scientists began to explore the grape as a medicinal food and found that grape contains a class of flavanol, flavonoid, polyphenols. Just chemical terms, but they're important as you study this. They have certain characteristics. These are antioxidants, also known as proanthocyanidins or OPCs, along with resveratrol and others. Grape skin contains the powerful polyphenol known as resveratrol, which acts as a phytoalexin. A phytoalexin is a chemical produced by a plant when the plant is under stress. Alex protected the gates in Greek mythology, so a plant protector is resveratrol. If the plant is injured or it becomes infected with a bacteria or fungus, resveratrol levels increase, its productions increase, and it's used to fight off the disease. Several plants contain resveratrol, including various berries, peanuts, and the two most important sources are grapes and the Japanese plant called knotweed. This is a bamboo-like substance, and it's a very particularly rich source of resveratrol, and many supplements will extract resveratrol from the Japanese knotweed as a source of commercially available resveratrol. While that was all being understood, this line of research, epidemiologists noted that French consume a high-fat, high-meat, and very rich diet. They consume a very rich diet, complete with daily wine, yet their disease rates are relatively low. Low rates of obesity, low rates of heart disease and cancer. And it was wondered, could this French paradox, could it possibly be due to the fact that they consume so much wine and grape products that they have a health benefit from that? We call that the French paradox. Could it be something in the wine, in the grape seed, in the skin? And what they found was that resveratrol, product of the skin of the grape, also activates a set of genes known as SIRTA1 and SIRTA2. These genes are known to promote thinness and longevity. When this genetic process is activated in lesser animals where it's easier to do controlled studies, it lengthens their life, and it promotes thinness. It turns on thin genes, and it promotes longevity. Another powerful oligoproanthocyanidin comes from the extract of grape seed. Now, when we bite down on a grape seed, what do? We go, oh, that's bitter. Well, that powerful bitter taste are these powerful antioxidants. Just like we discussed in olive leaf, that slightly bitter taste is the antioxidant. Same in the grape seed extract. We usually spit those seeds out, right? Well, we want to take that as a dietary supplement because they are very powerful oligoproanthocyanidins. Oligo just means it's a Greek word for few. So it's a collection of a few types of molecules that are proanthocyanidins. Cyanidin is a color. Cyanidin, color. Comes from the extract of the grape. Has similar properties to resveratrol, but slightly different. And that's not something we typically get in the diet because of the fact we spit the grapes out. Many grape seed and grape skin supplements also contain a related oligoproanthocyanidin, or OPC. We'll just call it that for ease of use. They take OPCs from maritime pine bark, We talked about it from the knotweed plant. There's a source. The peanuts can be a source. This is common. You'll see that. And together, this supplement, this variety, the symphony of OPCs have profound effects on the human body and promote wellness. These compounds have now become among the most studied of all nutritional supplements. And even among medicines, it ranks high in study. We have thousands of studies now, and this dates back to the discovery of resveratrol in 1963. Recently, it was discovered that the Japanese knew about resveratrol back in 1939, but they did not tell the Western world. If you know your history, in 1939, Japan was not friendly with the world. 1941, we became involved in that very much so in World War II, and they weren't sharing their scientific discoveries with the rest of the world. But Western civilization learned more about resveratrol in 1963. That's when it started. If we look at this as an overview and a summary of what we'll learn about products of the grape, what they do is they promote thinness, they lengthen life, improves parameters of diabetes control, very important there, lowers inflammation. Here's the big one, improves mitochondrial biogenesis. What do I mean by that? Mitochondria are the energy powerhouses of the cell. When the mitochondria works properly, it provides energy for all your cellular processes, all your detoxification, all your rebuilding, the energy to climb Mount Everest. It all comes from the proper generation of energy through the mitochondria. When the mitochondria are sluggish, when they're diseased, when they're toxic from poisons and heavy metals, we have health failure. Mitochondrial disease is a major reason for disease states in America today. And I believe that this is the unsung hero component of the grapes products, is how it improves mitochondrial function. And the research suggests that as well. But it also improves cholesterol and body lipids. It lowers the risk of cardiovascular disease and lowers the risk of cancer and can be used in cancer therapy. That's the overview. Now, a positive test tube in animal studies do not always translate into positive human studies. We're very aware of this. This is why we always have to test things in humans. But to date, we have over 210,000 research articles on public access on the World Wide Web throughout the entire scientific base of 210,000 research articles that at least discuss resveratrol and grapeseed extract, and many of them are original double-blind placebo-controlled. National Institutes of Health has over 9,300 research articles based on products of the grape. 9,300. There's no way we can talk about all those in one program, in 1 hour, can we? That is just absurd. So we summarize a lot of this, but by the end of this program today, you'll have a very good working knowledge of how you can use effectively products of the grape. Over 10,000 double-blind placebo-controlled trials on the World Wide Web. 10,000. So, you know, I always conclude, in my mind, I think this. You know, if a doctor says we don't know much about that stuff, there's no good research on that. What does that mean? They don't know. And God bless them, they need to study this more. They have their hands full with the medicines. That's my attitude. Medicines are the tough ones because there's so many drug interactions, there's so many side effects. Every year there's about 100 to 200 new drugs that doctors have to learn. Every year we have this. They have their hands full with that. Since these dietary supplements are essentially risk-free, that's our job. We can learn how to do that. We can learn how to manage that. So the notion of going to your MD and most DOs, unfortunately, and asking them about the intricacies of dietary supplements, it's not going to happen. What do you think? From your experience, if you talk to the average MD about grapeseed extract, is he going to know anything about that, the typical MD?
I doubt it.
I doubt it. So we can learn this on our own. Today we're going to review these trials. We're going to talk about the proven benefits of products of the grape, and we'll start that after these important messages. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
So call 888-442-1828 or go online at bioinnovations.net to place your order. Ask about the AutoShip program for additional savings.
Because chances are you are one of the 200 million Americans who need more magnesium every day. I'm Dr. Richard Becker for Your Health at a Glance. Does acid reflux keep you hooked on antacids? If so, you may be suffering from GERD, which stands for gastroesophageal reflux disease. GERD affects at least 20% of the adult population. In fact, Americans spend hundreds of millions of dollars per year on medicines to treat GERD. This is unfortunate because these medications have side effects. They can cause additional digestive problems, and they lead to nutrient deficiencies, such as the depletion of vitamin B12. Fortunately, there are simple lifestyle changes that can reduce the symptoms of GERD. Avoid lying down or exercising within 2 hours of eating. Lose weight because obesity worsens symptoms. Limit foods that cause GERD, such as fried, fatty foods, mints, chocolate, and caffeine. To improve digestion, eat a diet rich in fiber, yogurt, and drink lots of water. For Your Health at a Glance, I'm Dr. Richard Becker. Different people have different vitamin and mineral needs. That's why Dr. Becker's BioNutrients multiple vitamin and mineral powders come in 4 different blends.
That's right. When it comes to vitamins, no one formula is right for everyone. For those who don't get enough vegetables in their diet, there's the Organic Green Blend with 3 servings of vegetables in every tablespoon.
And for those looking for a boost of fruit and berry phytonutrients, there's the Berry Blend with 3 servings of fruit in every tablespoon.
And don't forget the Active Adult Blend with extra B vitamins, calcium, and added cofactors like ginkgo and CoQ10.
Plus, we've designed a multiple for those with allergies called the Low Allergy Rice Blend.
Whatever your unique needs are, BioNutrients has a multiple vitamin that's just right for you.
Give us a call at 888-442-1828 or order online at bioinnovations.net.
We're back, everyone, talking about how you can improve your health naturally with products of the grape. This is so interesting. Now, Richard, we're turning the table to resveratrol.
Yes, resveratrol. And we're going to review the scientific evidence. A few years ago, a drug company was trying to make a resveratrol-like drug. They started with the resveratrol molecule. They changed it so they can patent the molecule and trying to exaggerate the benefits of resveratrol. And they released public information saying like you would have to drink 1,000 glasses of wine a day to actually benefit from resveratrol. And that created a notion that this is worthless information. And don't even bother with that. Well, that is so completely not true. Here are the facts. You do absorb resveratrol. At least 6 double-blind placebo-controlled trials involving over 150 subjects show that oral dosage of even small amounts of resveratrol are absorbed and converted into 21 or more active derivatives, metabolites. As the body metabolizes resveratrol, it's converted into even more active subcomponents. As dose increases, so does the blood level. They've been able to prove that. Morning dosage with fatty foods provides the most absorption of resveratrol. You can take it any time. It won't harm you at any time, but you'll get more out of it if there's some peanut butter, some breakfast meat, or something that's got a little fat content to it, or oil. Blood flow. Do those small amounts affect the physiology? Blood flow. 4 double-blind, placebo-controlled, 88 obese or pre-diabetic subjects. As the dose of resveratrol increases, so does improvements in blood flow to the brain and peripheral tissues. It didn't take 1,000 glasses of wine. A reasonable dose, like what we talk about, creates improved blood flow in obese people. And it does in thin people too. But toxicity and safety. Study in 40 subjects with dosage of resveratrol from 0.5 gram to 5 gram. That's far and away more than anybody needs for a physiologic effect. There was no toxic reaction. However, the higher doses, 2.5 grams to 5 grams, tended to cause a little queasiness. You don't need that much, so don't take it. But there was no toxicity, and this was a very inclusive profile to determine, the mutagenicity. In other words, does it cause cancer? Does it damage the liver? And does it affect our DNA? None of that. No damage whatsoever. But at high doses, it can make you queasy. They also were able to show it was eliminated, and all that type. Now, oxidative stress. It's a powerful antioxidant, so 5 double-blind to placebo-controlled and even triple-blind placebo-controlled, 180 or more subjects, plus reduction of oxidative stress by influencing at least 10 different metabolic pathways. And it didn't take 1,000 glasses of wine to do this. A simple pill, a small pill every day will do this with resveratrol. Reduces oxidative stress in smokers, 22%. Even one dose, it doesn't take weeks to build up. Even one dose reduces oxidative stress. Lowers oxidative stress in angina patients. If you are you're having heart pain, you've just had a heart attack, there's compromised blood flow to your heart, it creates free radicals in the heart tissue that continue to cause damage, make you feel bad. You can't exercise, you can't walk across the room, causes you trouble. Free radicals are involved in that process. Even one dose lowers those free radicals in the heart tissue. Didn't take 1,000 glasses of wine, did it? Isn't that amazing? What else? Reduce adiponectin, which means you're going to want to eat less. It helps to keep the desire to eat reduced. Lowers oxidative stress in angina pernicious, reduces adiponectin, reduce blood clots, reduce 6 inflammation transcription factors. It genetically, through your DNA, controls your propensity to make inflammation. Even one dose will do this. Now, that's not a permanent effect. Do you follow me? So a pattern of regular ingestion leads to long-term benefits. Lowered activity of 27 genes associated with inflammation, all from product of the grape. This is just resveratrol. Similar results in smokers. Decreases C-reactive protein, a very sensitive marker of inflammation in the body. Lowers triglycerides with increased total antioxidant capacity, including boost in glutathione. That's oxidative stress. Cardiovascular disease. This is a summary of available research on resveratrol. 2 double-blind placebo-controlled trials with 150 heart disease, high-risk heart disease subjects. They're on the edge. They could have a heart attack any day. Even small dose, 10 milligram, you can barely see that. 10 milligrams of resveratrol improves ejection fraction, or the ability of the heart to pump blood out. One tiny dose improves ejection fraction, improves left ventricular diastolic function. What's that? After the heart has beat and squirted the blood out, it opens and draws blood back in. It's a siphon action, drawing it in. It takes more energy to open and fill the heart than pump it out. It improves that diastolic ability to pull blood back in and prime the pump again. In other words, the whole process starts working better, even with one dose. 10 milligram, that's tiny. I would take a little more than that for all the various effects, but you don't need a lot. Improves endothelial dysfunction, the root cause of hypertension, improves your LDL cholesterol levels, decreases red blood cell deformities, so you have better circulation, no plugging of the little capillaries, reduces plugging of the capillaries, reduces inflammation by about 20%, and increases anti-inflammatory markers 20. So the propensity to make inflammation and the propensity to calm inflammation are both augmented for a nice anti-inflammatory effect throughout the vascular tree. All of this with just resveratrol. A cross-sectional study of 1,000 people finds dietary intake is correlated with blood levels. So as you ingest more grape seeds, grape skin, resveratrol, and all these products, you have higher and higher blood levels, and it shows benefit in a dose-related fashion. Impressive. Those with the most resveratrol intake had significantly reduced triglycerides, improved heart rate, and decreased blood glucose levels. These are all driving forces to cardiovascular disease, diabetes, and its complications. Cancer, 4 double-blind placebo-controlled trials. There's far more than that available now, but if we can focus on these because they were good trials. Over 100 subjects, resveratrol and 4 active metabolites. As the body breaks it down, they were able to prove it penetrates into the tumor and the tissue around the tumors where the tumors are trying to invade. Activates enzymes that fight cancer. They were able to prove that. Isn't that amazing? And they studied that in colorectal and breast cancer and reduces proliferation. They were able to measure that. In healthy but susceptible to cancer subjects, resveratrol activated enzyme systems that protect from cancer. This is a major reason why people who consume the Mediterranean style of diet rich with grape products, they have lower rates of cancer, lower rates of heart disease, lower rates of inflammation and arthritis and pain. We have a break coming, but let's talk about diabetes and benefits of the grape when we return. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Give us a call at 888-442-1828 or go online at bioinnovations.net.
I'm Dr. Becker with Your Health at a Glance. Have you or someone you love recently been diagnosed with cancer? It is projected by the year 2020, some 18 million Americans will be cancer survivors. The main reason for this upward trend is our treatments for cancer are better than ever. Our cancer medicines are much improved, and we know more about how cancer works. In addition, holistic principles of cancer care are becoming standard of care treatment. Plus, research centers are discovering natural substances with true benefits for the cancer patient. This is an age of wonder, as we can incorporate both mainstream medicine and the fields of complementary and anti-aging medicine into your plan to beat cancer. I'm a cancer survivor who's here to tell you that you have more tools than ever in your battle with cancer. For Your Health at a Glance, I'm Dr. Richard Becker. For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-1828. Call today.
We're back, everyone, learning how we can improve our health naturally with products of the grape. And to help you get the products of the grape that you need, we have Dr. Becker's Bionutrients Grapeseed Complex. This has the grapeseed extract and the resveratrol. We have that buy one, get one free today. I don't want you to miss it. You buy one bottle at the regular price and you'll get a second bottle free. Great way to get the amount that you need. So, Richard, we have some amazing stories on...
Yes.
Resveratrol and the pre-diabetic.
Right. Pre-diabetes, diabetes, and the SIRT1 gene, SIRT1 gene. 6 double-blind trials, 90-plus diabetics or pre-diabetics. When they take resveratrol, it improves the measures of glucose control. you know, your long-term blood sugar, your fasting, and your 2-hour postprandial, they all improve while it lowers inflammation and oxidative stress in diabetic. Even minute doses, 5 milligrams shows a positive benefit to the diabetic or the pre-diabetic. 150 milligram a day dose of resveratrol, that's a little higher dose, and not everybody will need that, but you can do it. It's safe to do. 150 milligram dose causes an obese person's physiology to convert to that of a thin person. Think about that for a minute. Now, I'm not saying you should, if you're overweight, that you should still eat pastries and candy bars and drink sodas all day and just take resveratrol. That's absurd. I mean, don't do that. But you're doing your best, you're on the diet, you're walking, and the doctor says, you know, you're still having high sugar levels, your cholesterol's high, and I'm concerned. Well, put on the resveratrol, add that to your program. You're going to start seeing improvements. That's what the research says. Reduces liver enzymes because it can inflame the liver, this high glucose level. It lowers glucose, lowers postprandial glucose after you eat. Triglycerides and other liver fats, reduces inflammation while it activates. It's through a genetic manipulation, which is really quite remarkable. Now, a 3-gram dose, which is a high dose of resveratrol, created the physiology of exercise in sedentary, obese people. These are not my words, they're not my ideas. This came right out of the worldwide literature. A 3-gram dose created the physiology of exercise in sedentary, obese subjects. It's the closest thing to exercise in a pill yet discovered. Isn't that amazing? It truly, truly is. Animal studies designed to replicate diabetes found resveratrol protected from diabetes-induced kidney damage. Medication-induced kidney damage, aldosterone-induced kidney damage, the driving force of hypertension and diabetes and many other conditions where it's hypertension. Infection-induced kidney damage and ureteral obstruction due to kidney damage due to kidney stones. You know, can obstruct the flow of urine. It's such a powerful antioxidant that it can help to prevent damage from all these terrible scenarios that happen to humans. Here's another one on skin conditions. This really is quite remarkable if you think about it. Double-blind placebo-controlled 50-plus subjects. Resveratrol reduced acne by 50% when applied topically. They did a half-face study. 50% reduction in acne. So you could use a non-comedogenic skin cream. In other words, it doesn't cause acne, because you have to be careful with acne. Not everything is helpful. And just open a resveratrol or a grapeseed with resveratrol capsule and sprinkle a little in there and apply it at bedtime. 50% improvement in acne. That's remarkable. I think that's wonderful. So you can use it topically and systemically. They also found that resveratrol is rapidly and effectively absorbed through the skin. It's absorbed more through the skin than through our intestinal tract. 62% absorption. We can't even come close to that with oral administration. That's an opportunity for somebody who wants to perfect skin application of resveratrol. Isn't that amazing? Now, recent research has drawn into question whether resveratrol really works. And as I went through that, there's several studies that said, I don't know if this stuff actually works at all. And what they did was they gave huge doses, 5 grams and up. And what they find with large doses, high doses of resveratrol, it doesn't cause toxicity, but it doesn't affect the gene. It doesn't do the antioxidant thing. So here's the bottom line. Here's the advice. You don't need high doses. You don't need to take 10 pills a day. It's a waste. 1 capsule a day of resveratrol is enough for the vast majority. Isn't that amazing? Now, what do we know so far? Resveratrol in the grapes, proanthocyanidins, they are absorbed, and they may be metabolized into other products that are also active. So you can't just follow resveratrol through the system. You also have to follow what it's metabolized into, because these metabolites are active as well. It's absorbed, we use it. Resveratrol activates the SIRTA1 gene, which creates the metabolic effect, turns obesity into thin physiology. That's what we're looking for. And the SIRTA2, which promotes longevity in lesser animals. We don't know for sure in humans, but if you have lower disease rates, you're probably going to live longer. Makes sense. Resveratrol promotes cardiovascular health by countering endothelial dysfunction, cholesterol and blood fats, one of the causes of heart disease, and it helps to lower blood pressure and salt-sensitive hypertension by an astounding 12-point drop. That's the multiple studies. Resveratrol improves diabetes by improving measures of diabetic control. Your glucose is improved. It does all of this. It is a powerful antioxidant, detoxification agent, reducing inflammation by 30% or more. That's impressive. See, if you completely wipe out inflammation, what do? You stop healing. The inflammation triggers the healing process. We just want to control it. We don't want a long, smoldering fire. We want to do the fire, get it over with, get on with the healing, and be done. And that's how resveratrol helps in the long term. Calms it down, get the healing done, but you need a little, but not too much. It acts as a powerful anti-cancer agent, activating enzymes that help to lower cancer risk, helps to counter the side effects of cancer therapy. It passes readily into the blood-brain barrier and into the brain where it does its own necessary work. It is a powerful antibiotic. Remember, it's a phytoalexin. It works great on yeast and various bacteria. And to date, attempts to make resveratrol into a drug has failed. When you change the molecule, it leads to toxicity, even kidney damage. The original is fail-safe. The original comes without side effects. Now, let's go to our break, and when we return, let's talk about products of the grape seed. We'll be right back. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings. Here is our hope for you today. I'm Cindy Becker. In the epic movie Gone with the Wind, Scarlett O'Hara says she won't think about her problems today or she'll go crazy. She'll think about them tomorrow. How should we think about tomorrow in our lives? In Matthew 6, verse 33, we get advice about tomorrow. Seek first his kingdom and his righteousness, and all these things will be given to you as well. Therefore, do not worry about tomorrow, for tomorrow will worry about itself. It's so difficult to not worry about the future. Many of us catastrophize about the future. That's spending all your time thinking about all the catastrophes that might happen. So let tomorrow worry about itself. That way, we won't miss the wonderful things happening in our lives right now. I'm Cindy Becker. This is our hope for you today.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out our AutoShip program for additional savings.
We're back, everyone. I just want to give you a little reminder. We have our Dr. Becker's Bionutrients grapeseed extract with resveratrol, which we call the grapeseed complex. This is fantastic. This is buy one, get one free today. Don't want you to miss it. So, Richard, now we're going to talk about the benefits of grapeseed extract, why we should supplement with that as well.
Well, grape seeds are not a normal part of our diet. We tend to spit them out. In fact, seedless grapes, they actually do have a seed, and we swallow those. So that's really a better source for grape seed. But you have to break them down. These are fat-soluble substances, and it's harder to do that. It's better to take the big seed, crush it, and release all those powerful proanthocyanidins from the grape seed. Grape seeds contain flavonol, flavonoids, just like resveratrol, but they are different. Remember, they're oligo, a few proanthocyanidins. So it's this family of compounds. And your varied source provides varied health benefits. Varied source, varied health benefits. They are powerful antioxidants, more powerful than vitamin C, vitamin E, or beta-carotene, and they also activate the native antioxidant pathways, just like resveratrol. They are typically used in cardiovascular problems, such as diabetes and wound problems and phlebitis, inflammation of the vascular tree. Very effective for that. Supports capillary integrity, circulatory system, increases endothelial growth factor, so you can generate new blood vessels when you need it. It has anti-inflammatory properties and anti-allergy properties, antihistamine properties. It protects from infrared radiation. This would be something in gamma rays. This is something that a pilot should do, because that radiation, the gamma ray, it goes right through the aluminum skin of an airplane. That doesn't even stop it. Doesn't even come close. And you're exposed to high gamma radiation. If you take a high antioxidant diet, it makes a difference over time. The grapeseed extract has a long half-life. It stays in the body for 3 days, so that means you don't need a lot of it. Smaller doses last a longer time. You could even skip days with that and still have it. And this is true of the resveratrol, too. If you need to economize, and who doesn't, every other day is more than enough of these type of products. Every other day. Little tips that help you make this fit into a budget. What are the benefits? Well over 1,000 studies published at PubMed, that's the National Institutes of Health, and worldwide there's about 80,000 research articles that at least discuss in part, and some are exclusively dedicated to grapeseed extract. Benefits attributed to the oligomeric proanthocyanidins: reduces blood pressure by 12 points, keeps blood vessels soft, pliable, prevents arterial plaque oxidation, particularly salt-sensitive blood pressure. Quite effectively. Add this with your vitamin D, your high potassium diet, exercise, more fluid intake. Not everybody needs to be on 3 drugs to control blood pressure. When we start adding more and more medicines to control blood pressure, that's when we get all these terrible side effects. They add the diuretic, then the beta blocker, then you're tired all the time, and you stand up and you feel like you're going to faint. If you're on that kind of program, you know what it's like. Maybe one medicine and a smartly compiled list of dietary supplements. Maybe that's the best option. Lowers blood pressure, particularly in postmenopausal women with salt-sensitive hypertension. Pay attention, ladies. If your blood pressure went up with menopause, think products of the grape. Decreases LDL cholesterol 13% while increasing HDL cholesterol by about the same 13%. That's nice. Protects against cellular damage to microscopic blood vessels. Pay attention, diabetics. Protects the microcapillaries, the small blood vessels. This is where the damage of diabetes is occurring, and this is where grapeseed helps you so much. If you could remember that, grapeseed for the tiny blood vessels. Now you have a basic guiding tagline, soundbite to help you understand where to use grapeseed extract. Active against a wide variety of infectious agents. It's a phytoalexin as well, including viruses, bacteria, and fungi. Active against a wide variety of cancerous cell lines, including cancers of the head and neck. Those are some of the most difficult to treat cancers that humans suffer from, head and neck cancers. Very difficult. And it does this by damaging the cancer cell's DNA and initiating apoptosis, and very similar to resveratrol. Many benefits of the grape seed extract are unique and not necessarily found in resveratrol. Here's a few of those. Relieves the pain and swelling and burning of varicose veins, phlebitis, and hemorrhoids faster and more effectively than the medicines approved by the FDA, and they're safer as well. Please remember this. If you have varicose veins, phlebitis, hemorrhoids, inflamed vascular tree, vasculitis, grapeseed extract is for you. Improves integrity and structure of collagen, elastin, and proteins needed by cartilage, tendons, skin muscles, and blood vessels. Promotes rapid and complete wound healing. I think as we study these food extracts, you're coming to understand why a healthy diet is so important. Don't just rely on your supplements, eat healthy too. This is why people who eat healthy live longer and have less disease and suffering. Reduces the formation of Alzheimer's disease-associated plaque formation and cognitive decline in animal studies, and they use these animal studies because they very closely resemble humans. And so if it helps prevent it in animals, it probably does. And Mediterranean diet followers have lower rates of Alzheimer's, dramatically lower. Improves lens elasticity of the eye. Presbyopia, you can't accommodate. You have to hold things further. It helps to keep the muscles that control the contraction of the lens soft and pliable. It keeps everything working so you don't have to get your arms extended. You know, that's no joke, right? So it helps you accommodate your vision, accommodative vision. It helps to reduce the release of histamine during allergy attacks, and it decreases swelling, inflammation, and pain associated with severe allergies. Reduces the reactive oxygen species in skin when exposed to ultraviolet light and infrared light. So it helps. This also means it applies to radiation therapies for cancer. And we have a bunch of double-blind placebo-controlled trials, and I basically summarized those to give you that information. So let's go to our break, and when we return, let's talk about how do you spot a good grape product that you can use to effectively help manage your health conditions. We'll be right back.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online or call 888-442-1828 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Could some of your favorite foods be making you sick? Cases of non-allergic food intolerance are on the rise. This is different than food allergies. Recent surveys reveal up to 20% of us may be suffering from food intolerance. People who have a higher risk of non-allergic food sensitivity are those with other types of allergies, such as hay fever, or irritable bowel syndrome, hepatitis C, chronic indigestion, abdominal pain, or constipation. Non-allergic food intolerance can be delayed up to 48 hours or longer, so you may not connect something you ate 2 days ago with fatigue, headaches, abdominal pain, or depression. You can keep a food diary and write down everything you eat. Blood tests can diagnose the problem, or an elimination diet can help you detect the foods that are causing your symptoms. For Your Health at a Glance, I'm Dr. Richard Becker. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings.
Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Just a quick reminder, our BioNutrients Grapeseed Complex is buy one, get one free today, so don't miss it. Richard, I know time is short.
Yes.
Let's talk about who would be the most helped by and benefited with products for the grape.
Yeah. You know, if we look at the top 20 diagnosed conditions in America, each and every one of them could be benefited by products of the grape, resveratrol grapeseed extract. I'm including cardiovascular disease, all the vascular dysfunction we have, peripheral vascular disease, vasculitis, even hemorrhoids, anything inflamed in the vascular tree. These remarkable substance can be a benefit to you. Diabetes, pre-diabetes, metabolic syndrome, weight gain, high cholesterol levels, a major driving force of our cardiovascular disease. Neurologic conditions, the neurodegenerative diseases, Alzheimer's, Parkinson's, MS, this type of thing. It gets into the brain. It helps that. It's really quite remarkable nutritional support for all these conditions. Cancer in all its varied forms, and assisting cancer chemotherapy and radiation, making them work better with less collateral damage. I wish we could get this into the thinking of America, that when we are diagnosed with cancer, we also start a expertly placed together nutritional program. We would see a true spike, and we are beginning to see that. Our cancer cure rates are improving, and I think it is at least in part to more acceptance of nutrition. And they're doing a better job of making better chemotherapy agents, more specific targeted therapies, but also more people, you know, it's like 70 to 80% of cancer patients now are supplementing with their care. And it's making a difference. So this is very good. Any type of infectious disease, especially, I always think of the chronic, and you have chronic sinus infections, one after the other, chronic fatigue syndrome, maybe you get cold sores, maybe you're an HIV patient or a hepatitis C patient. Any chronic ongoing infectious process can be benefited. Arthritis, pain, inflammation, autoimmune diseases, liver dysfunction, pancreatitis. People who take a good antioxidant program with pancreatitis have fewer painful episodes with less pain when they do have them. Antioxidants help pancreatitis. We can go on and on. Allergies. You know, whatever's ailing us, a good, sensible program with products of the grape can be helpful. Hypertension. Well, what do we look for? I like to think of this as a compilation of all of these a group of few molecules. It's like a symphony of molecules from the grape. Why would you exclude any of them? And then the knotweed, the Japanese knotweed, you can get these different sources and put them, the maritime bark extract, and then you get a good complement of these oligoproanthocyanidins, and you get the full effect of all of them, because it doesn't take much. 50 milligrams, 100 milligrams of resveratrol a day, grape skin extract 25, pine bark extract 25. Take that every day, every other day. That's all you need. You don't need huge doses, maybe to start, but not for long. 1 or 2 a day is all you'll need. Skip days is fine too. Well, thank you for your kind attention. I hope we made a difference. We'll see you here tomorrow. Bye-bye.
Thanks, everyone. We'll see you tomorrow right here on Your Health. Bye-bye.
Golfers, the future of golf is here. The coolest driver on the planet, Jack Ham, world's longest driver and #1 golf designer, has done it again. The Hammer Turbo Air. The aha moment. It's all speed. This is real golf technology. The Hammer Turbo Air. The world's longest driver. Go to hammerturbo.com now. Putting the science of speed into golf. Boom.
Introducing Paisano, the authentic pizza oven by Granite Stone. Now make the world's most delicious pizza with real stone right in your own home. You simply set it and let it make golden, crispy, extra cheesy stone-baked pies in under 6 minutes. You can get your Paisano pizza oven for just 3 easy payments of $39.99. Plus, we'll ship your entire order free.
Call 1-800-299-6812 or order online at buypaisano.com.
I'm Richard Karn, and I love my hose. It ain't those old hoses. This is my hose. The new Pocket Hose Copper Bullet, now infused with real copper, so your water is always clean and